From our Capitol Bureau tonight, monkeypox is spreading to some states in the U.S. and one case was just recently identified in Colorado, which is a neighboring state. Experts in Kansas are weighing in on the history of the disease and what to look out for. Fox 43 News Capitol Bureau reporter REBEKAH CHUNG explains.
Well, the last monkeypox outbreak was in 2003, and Kansas was one of 6 states impacted. Now, health experts say it's not likely this will become a pandemic, but there are actions that can be taken to prevent this from spreading. Monkeypox, a rare disease usually occurring in West and Central Africa, is now spreading in states in the U.S. As of Friday, at least 8 states are tracking cases.
Not been associated with severe complications, but clearly it's a novel new infection in certain high-risk populations.
It's not as severe as coronavirus, but it can take a toll on people who are immunocompromised. A rash, fever, and swollen lymph nodes are just some of the symptoms. Some states like Colorado are setting up contact tracing efforts, and on a national level, plans to ramp up testing are underway.
Anybody can get this disease. It is obtained by close contact with people who have the disease.
In 2003, Kansas was one of 6 states in the U.S. impacted by an outbreak of monkeypox. All people infected during the outbreak came into contact with pet prairie dogs. The pets were infected after living near small animals imported from Ghana. Lab testing and smallpox vaccines were used to prevent the virus from spreading. Experts say it's one of the reasons they may be able to respond to the disease quickly.
The process will be an offering of the smallpox vaccine. We know that has been done in Nigeria. We know that has been done before in the United States. Vaccination will continue to have a preventative activity even up to 4 days after the exposure.
Now, health experts say the virus isn't a cause for fear, but rather awareness. Right now, there's at least 257 cases confirmed worldwide. For now, reporting at the Capitol, I'm REBEKAH CHUNG.
Now, the virus has not been detected in Kansas yet. A spokesman for the state's health department says plans to train providers on identifying and treating the virus are starting. For people who may have symptoms, the department recommends contacting your healthcare provider.